Hey everybody, my name is Stacy Stanifer and I'm an assistant professor in the College of Nursing at the University of Kentucky. And I'm also the co-lead of the UK Center for Appalachian Research and Environmental Sciences Community Engagement Corps. Today, I'd like to share with you how our NIEHS funded P30 Center works to build capacity for environmental science by creating strong community academic partnerships. To begin, I'd like to tell you just a little bit about our center. So UK Cares is one of 25 environmental health sciences core centers in the US, and we are funded through the National Institute of Environmental Health Sciences, which is a division of the National Institutes of Health. Our mission at UK Cares is to work with the community to discover and translate research on how the environment affects the health of people in rural central Appalachia. And we do this by working closely with leaders and residents to listen to the concerns of the community, connect the community with scientists at UK to plan and conduct research of interest, and then report back to the community what we're learning. So the CEC is, or Community Engagement Corps, is one of 5 corps that make up UK Cares. And the Community Engagement Corps is a central part of the structure of the center by ensuring that the community's priorities remain a driving force in all that we do across the entire translational spectrum. We partner with our pilot project program to ensure support for community engaged research. This did not happen overnight, but our Community Engagement Corps has created and sustained a strong community academic partnership that's built on decades of consistent support, mutual trust, and genuine respect. And these partnerships have really facilitated meaningful community engagement in environmental health literacy in Appalachia, Kentucky. UK Cares, we have a stakeholder advisory board that's made up of members who represent a range of racial and ethnically diverse professionals and community members who live, serve, and work in rural Appalachia, and they advise us in all of our activities. In addition, we frequently hold listening sessions, and many of our research projects involve citizen science, where members of the community are engaged right alongside our UK faculty in research. And then lastly, we very strongly feel in reporting findings back to the community. And we do this in a variety of ways, such as offering science communication training and using novel approaches like Facebook Live presentations. So why study environmental health in this region? So environmental health is a field of science that studies how the environment influences human health and disease. And in doing this science, in discovering how the environment affects people, we can then promote healthier lives. So our region with UK Cares consists of the Big Sandy, the Kentucky River, and the Cumberland Valley Area Development District. And you can see that area highlighted on this map. In this region, decades of mining and fracking, as well as aging and inadequate water infrastructure, has resulted in long-term exposure to water and air contaminants and contributed to the increasing frequency of natural disasters like the serious flooding that we're seeing. The long-term exposures have contributed to high rates of environmentally induced disease, and people in the community are concerned. In 2020, we enlisted the support of our community partner organizations to distribute a community environmental health assessment. We invited those who live and work in the UK Care region to tell us about their concerns related to the environmental health. Collectively, we had 261 community members complete the assessment. This region-specific reports that you see here are available on our website for download, and they include community concerns related to indoor and outdoor air, water, and emerging threats. We're currently working with our SAB members, as well as community organizations and the Community Impact Office at the UK Markey Cancer Center to disseminate these reports widely. I'd like to share with you an example of a successful community academic partnership that occurred in Martin County, Kentucky, and was led by Dr. Jason Unrein in the Department of Plant and Soil Science in the College of Agriculture. So this project started when a member of our Stakeholder Advisory Board brought to our attention that residents of Martin County had concerns about their drinking water. And these were long-standing concerns. It stemmed from the Martin County coal slurry disaster in October of 2000, where 306 million gallons of toxic coal slurry were spilled into 2 main waterways. In addition, there were concerns about frequent water outages and brown water that was occurring throughout the county. So the CEC shared these community concerns with Dr. Jason Unrein and other UK scientists, and we recruited a team to address their concerns. Dr. Unrein and his team held listening sessions with Martin County concerned citizens to learn more about their concerns. And then these coalition members helped to inform the pilot study design, which was then funded by UK Cares. Before the study even actually started, members of our CEC team conducted confidential key informant interviews with Martin County residents to inform the health survey that was used in the study. In the end, residents from 97 homes selected at random collected drinking water samples, and the team analyzed the samples for chemicals and bacteria, and the residents completed a health survey. The team found that the drinking water had observed levels of cancer-causing disinfection byproducts like chlorine that regularly exceeded the EPA maximum contamination level, as well as evidence of coliform bacteria. The community-led coalition and citizen scientists planned and delivered the report back of these findings through print, TV, and social media. And findings from this pilot study have led to an NIEHS-funded Research to Action grant that's being led by Dr. Jason Unrein and Assistant Professor Dr. Anna Hoover from the College of Public Health, along with 3 community-based nonprofits. And their goal is to identify and reduce drinking water disinfection byproduct exposure in Martin and Letcher counties in central Appalachia. Exposure to high levels of disinfection byproducts are associated with cardiovascular birth defects and, in the long term, bladder and kidney cancer. Disinfection byproducts are among the most frequent drinking water quality violation in the US, yet there is little research on this water contaminant. Another example I'd like to share with you is our participation in environmental health working groups. So in 2020, concerns related to the then emerging COVID-19 pandemic and its effects on community residents with Black lung disease was shared by an SAB member. So a COVID-19 Black lung working group consisting of representatives from several community organizations, a local well-respected community physician, CDC NIOSH representatives, and our CEC team was formed. And this working group collaborated to educate the high-risk population of active and retired coal miners in the region to the risks of COVID-19. We worked with that community physician to develop a series of public service announcements for coal miners and materials for distribution in clinics across the region. PSAs aired on 10 radio stations and were featured on Facebook. Annually, in collaboration with the Pilot Projects Program, our Community Engagement Corps distributes a request for applications for community grants ranging from $5,000 to $10,000, which support environmental health research that is led by the community. Projects must contribute to the science of the prevention and treatment of environmentally induced disease in the target region and be consistent with the community concerns related to water, air, and emerging threats. The Community Engagement Corps facilitates faculty collaboration with community applicants for consultation and leveraging of the institutional resources that UK can offer for this project. Study findings are then reported back to the SAB, or Stakeholder Advisory Board, and the community. And to date, 16 community grants have been awarded, totaling $151,765 in funding. An Exemplar community engagement grant involves Mr. Craig Wilmhoff and his students at Perry County High School. In this study, Mr. Wilmhoff and his students were trained to monitor diesel exhaust emissions surrounding school buses using low-cost air beam monitors. Mr. Wilmhoff and his students' work has been highlighted in the International Journal of Environmental Research and Public Health, and recently was accepted as a case exemplar for the upcoming 3rd edition of the Principles of Community Engagement. Perhaps even more exciting though, findings from this community grant saved this rural school system 50% off the purchase of 3 new low emission buses through a settlement with Volkswagen. The total savings for the school system was approximately $130,000, resulting in a 13-to-1 return on investment. So we recognize that we could not do this work or be as impactful without our community partners. And therefore, each year, UK Cares recognizes an outstanding individual or community academic team with the UK Cares Community Engagement Award. Nominees for the award have demonstrated outstanding achievement in and commitment to community engaged research or project evaluation to improve environmental health in Appalachia. Winners are chosen using an external panel of experts in environmental health and community engagement. Lastly, we'd like to share with you information on our recently developed community engaged research training module. This free 45-minute module presented by community partners, citizen scientists, and community engaged research faculty will help prepare researchers for conducting meaningful community engaged research. This is a free training and open to everyone, so please share with your faculty, trainees, research staff, and students. To learn more, please visit our website or follow UK Cares on Twitter. Reach out if you have any questions or ideas for collaboration. Thank you for your time.